everyone again. This is Whitney Morgan, Northwest College EMS Program, continuing our educational shorts on educating ourselves about COVID and hopefully getting some reliable information to the masses, especially our students, as we enter through this time. So, to start, I have a fun little video here. Again, made with Animaker, free video software if any of our other instructors are looking for tips or hints that you can make some pretty cool videos and then just download them. So here we go. That's voodoo with an O. Okay, so we're not going to be around people. And here's an important fact. Not all symptoms require a doctor to be around to help you. So, you can do things at home to help yourself if or when you get the COVID disease. If you have a fever, we know how to treat fevers. We take what's called antipyretics or NSAIDs, which are non-steroidal anti-inflammatories, to help reduce our fever. So if it's making you uncomfortable, then you can take medications to help reduce fevers. And that is for children and adults alike. Obviously, we do not give ibuprofen to children that are less than 6 months of age. And you may want to consult your physician if you have bleeding disorders or liver issues, because they may ask you to use only specific antipyretics. But there are options for home treatment. We take them for headaches, we take them for other fevers. Yes, you can take them for the coronavirus. Fluids. So, yes, if you are not able to intake as much because your throat hurts or you don't feel well, you need to intake fluids. The best recommended is always water. Some of us don't like water. Put some lemon juice in it. Put some flavor enhancers in it. If you want to drink some sodas, that's great, but get some water in you too. Juice is an option. Anything liquid, let's put it in our bodies, not alcohol. Alcohol is very dehydrating. But let's get some fluids going. The whole, I'm going to make you chicken noodle soup as a mom rings true. So drink some broth, make some soup, and then eat it so you get some good protein in there too. When it becomes an emergency is when you cannot breathe. So we talked about how this is a severe respiratory syndrome that happens suddenly, which is what acute means. So when you begin to have problems breathing, that is when we want to go seek help. Not necessarily because you have a fever or sore throat. Sore throats can be caused by a multitude of things, viruses included. We don't have a cure for viruses at all yet. So even HIV, which is a virus, has no cure. So we are not going to be able to wave our wands and give you something that's going to cure you of this. But if you do have a sore throat with the possibility of a strep throat infection, which is a bacterial infection, we can do something about that. We've got antibiotics for bacteria. So it might be wise to go to your personal physician or an urgent care clinic and say, hey, I've got a sore throat. Do I have a strep throat infection? And I'll let you Google the signs and symptoms of that and decide that for yourself. But there are ways that we can test for that to see. And it doesn't mean because you have a sore throat, you have the coronavirus. Again, our concern with this virus is not that you have it. It's minimizing the spread of it and then treating the symptoms of the severe breathing issues that are associated with it. Not everyone gets severe breathing issues. Only certain members of the population or certain people who are infected with it do. But that would be the time you actually do need to seek out medical care, because otherwise just going to the physician's office because you're positive for this does nothing but spread it. There's maybe some reassurance for you, but there's not going to be any secret treatment that they're going to be able to give you to cure you of it. So it's when we start to begin to have those problems breathing that we need to go into the emergency room and have them use more invasive tools to help us keep breathing. So that's when the true emergency begins. Continuing on with our little doctor graphic here. self-isolate, one caregiver with a closed door. Let's just talk briefly about that. So if you are sick at home, which many of us will become likely sick at home, the CDC recommends to assign one caregiver to that sick person. So I know when I don't feel good, I want to just lay in bed, maybe watch some Netflix. Normally I'm a big sleeper and napper, so I like to just sit there and be miserable by myself. Other people are more extroverted than I and like to share all of the joys of their life, including their sickness. But what you should do if you have a family, for example, I have 3 young boys and a husband that live in a home with me and a dog named Coco. So I don't want to get them sick as well. So what I might do is I might go into my bedroom and stay in there for the duration of when I am exhibiting symptoms of this. What would be nice about that is I want to be in a well-ventilated area. So maybe I open up, I have a door to the outside from my room, and I open up some windows, turn on the fan, get some air circulating so there's not stagnant air in there. And maybe my husband decides he's going to be my caregiver and he's going to be bringing me in soup or giving me fluids that I need, etc. But minimizing the exposure to him. And having it so that only one door is accessible to that room. So I'm in a bedroom, I'm hanging out, and only one door is going to let him in or out, and we're going to restrict the kids from me during that time. Now that seems kind of weird, you know, you're keeping your kids away from you, you're feeling like you're letting them down, but really you're protecting them. You're protecting that particular person from the transmission of the virus, and maybe you do some different things, make it into a game. And most people have cell phones these days, and maybe you video chat or you pass notes to one another, or make it into something where especially kids can use their imagination and be somewhat excited about it, even though it's hard to isolate yourself from them. So one caregiver that you've selected is going to take care of anyone sick in your house with the coronavirus. If more than one person becomes sick, maybe they all hang out in one room, bring a TV in, catch up on some Netflix movies, play some games. Even if it's games, I've seen kids play games sitting right next to each other, which is bizarre to me, or you could go into Monopoly, and if I were sick, I would gladly join you in that because I'm a total Monopoly master. Here's our doctor again. Here are some things that we can do to help prevent this transmission. So, wipe down surfaces. So if we've got those antibacterial wipes, let's wipe them down. And I'm going to teach you an alternative to that here in a minute. Stay away from those the most affected. So we know that the older population has a higher rate of mortality rate from this. So we do not want to go visit our grandparents during this time. It's going to be really tempting to do those things with our children, especially when they're not in school. I'm making up things to do with my kids while they're not attending school for the next couple weeks. And it's very tempting for us to be like, okay, I am totally going back to Nebraska, hanging out on our very isolated farm, and we're going to be safe there. Well, granted, we may be less exposed to people, but we would be exposing people like my grandmother who lives on that farm as well. And getting my kids around her could cause her to become very ill. So those most at risk we want to prevent the transmission from, and that would be keeping away from them during this time. And again, keeping away from them doesn't mean that you aren't calling or writing letters or emailing or staying in contact. It just means that you're not going to their house during this time and otherwise infecting where they live. Cover your mouth when coughing and sneezing. That seems simple enough. However, a lot of people do it wrong. A lot of people like to cough into their hands. Please do not do that, because then you touch everything with your hands. We want to use the elbow technique, which I know a lot of school children are being taught, which is awesome. So if you don't know it, have your super smart child teach you, or a random child that you're exposed to, have them teach you. But you're going to raise your arm when you are about to cough, and you're going to cough into the crease of your elbow, trying to catch all of the stuff that escapes from your body when you cough or sneeze. Because that's your body's goal of coughing or sneezing, is to expel or to push out stuff, and then it goes into the universe, and we share the universe, so then it goes into someone else's body. So we're going to try to catch all that stuff. So use your clothes to try to catch all that viral load when doing that. We already talked about washing our hands. Wash, 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 especially when preparing food or eating. Try not to touch your face very frequently. Wash down. If you work in an office like I do, scrub the surfaces down. Wash off doorknobs and toilet handles are pretty frequently touched. Wash off faucet handles every once in a while. Just keep things clean. And I understand that keeping things clean is not easy. I have 3 boys who currently are battling the coronavirus by building forts in our basement. And there are currently 5 tents and a fan and Nerf guns to combat the coronavirus. So I totally get mess, but we're going to try to do the best that we can at this time to keep as clean as possible, wipe surfaces down when we can. The do not reuse utensils thing is a big one. I know that we don't like to do dishes at my house, so we will reuse cups pretty frequently to try to minimize the amount that goes through the dishwasher. At this time, you're going to need to wash a lot of dishes. Use a cup for a meal or for drinking and then replace it. So usually what I try to do is after every meal, I put all of those dishes into the sink and into the dishwasher and wash them. Maybe they have a snack cup because my kids drink an absorbent amount of juice and water and milk. So they get a lot of different cups during the day. So just making a snack cup and then washing that. Using some sort of cardboard juice that will break down. The plastic water bottles, yes, they do work. The disadvantage with that is obviously then we contribute a lot of plastic to the environment. So if you can put those through the dishwasher and try to wash them and then fill them from your sink, that's a great way to reuse them. Or iodine tablets, some of your reusable water bottles so that bacteria doesn't grow and you create a lot of other things. Now, distance greetings is one of the last ones, and that's utilizing this little hand here to shake hands. Let's not do that anymore. Maybe you throw up the peace sign to your homies as they're driving around, or you give a little wave. Just try not to come into physical contact with anyone right now. The rule of thumb is 6 feet away from a person. So how do we greet someone from 6 feet away? Maybe you do an air high five, thumbs up sign. You don't need to necessarily come into physical contact with people during this time in order to acknowledge them and to say hi and to reassure them. So think of alternative ways that we're going to be doing these greetings from a distance. Okay, so I promised you an alternative to disinfecting your surfaces. And this is going to be called Whitney's Solution for Cleanly Goodness. So this is a prominent recipe that we used a lot, especially with HIV/AIDS education, because you can kill HIV on surfaces with bleach and many other bugs that come into being. Hepatitis B can nastily live on surfaces for 60 days in dried blood. So we need to know how to kill these things that are reaching their surface. And we know that the COVID-19 disease can be transmitted through droplets. So we want to be able to clean our surfaces. There have been a mass amount of people buying antibacterial wipes and sprays, so that it's very hard to come by. But so far, I don't think we've had a selling out of bleach. So an easy way to create your own disinfectant solution that is super effective is to use bleach. Try not to smell it. It does not feel good on your nostrils. But you're going to use a 1/4 cup bleach, and you're going to mix it with 1 gallon of water. Again, you can make the water hot if you want, but just know that when you're wiping down surfaces, if you're putting your hands in there, it's going to break down that skin, so maybe not the best way to do it. But any type of water is going to be fine. Use cold water if you want. Put the bleach in there and then wipe down your surfaces with that. Maybe you replace this once every 24 hours as you clean. Put it in a spray bottle. You can spray it on your surfaces as a replacement to that. So this is a nice alternative that's going to kill the germs. If you have any white clothes that need washed like I do, you can also brighten them up. So two-handed. Everyone's going to be super impressed by my drawing here. Sorry, students, you've already been exposed to it in class, but now the masses are going to see how talented I am. And these figures are meant to be humans, but they look a lot like the Easter Island heads. So we can pretend they are whatever they are. But let's talk a little bit about how this gets transmitted. So we know that the virus here, and then we've got little spikes, looks kind of like the sun, aliens. it's going to go in here into our respiratory tract. So it enters through our nose or goes in through our mouth, and then it's going to attach. And then we know from previous presentation that it begins to replicate within our body. Well, once it's living in here, then all of a sudden your body's, one of your mechanisms for getting rid of it is achoo. So all of a sudden achoo, you're expelling it, right? And this person was caught by surprise by their achoo. They decided not to cover their mouth with their hand or their elbow. That's supposed to be a hand. Good. So this went into the universe. Well, Pete here is chilling out, and then he sneezed, and then Wanda had the misfortune of being near him. So they were at the grocery store shopping for toilet paper. I don't know that I should draw toilet paper. It might look like something else. But Wanda and Pete were fighting over a roll. He sneezed. Well, guess what? Wanda inhaled around the time that Pete sneezed, and there went that virus. And it went in and began to attach itself to those receptor sites in her respiratory tract. So now Wanda's been exposed. Maybe Pete, instead of blowing it into the universe, put it onto his hand. And then Wanda and Pete, being good friends, decided to shake hands. So then it went from one surface to another. And then Wanda decided she was going to eat something, and it went back into her tract. So these are primary ways that if we're in close proximity that these are going to be transmitted. So sneezing, coughing, handshaking, these are the things that we want to avoid. And we want to put distance, again, between one another, 6 feet of it, in order to be safe. Thank you again for joining me for this educational short. I'm sure we'll have more to come. Hopefully you've learned something, or we'll share this with someone that needs to learn something. I appreciate your responsible diligence during this time, especially to my students who are either healthcare providers or will be future healthcare providers. Equipping themselves with sound knowledge and being able to be dependable during this time is a huge resource for the public. So thank you very much for that, and thank you for joining me.